So let's go way back.
Okay.
Did you decide to be a nurse first or a comic first, or when did you find out you were funny?
Am I a comic? I guess I do.
Sure.
Actually, you know what? I wanted to do something in healthcare, and I thought I wanted to be a doctor. And one summer when I was in high school, my mom said, "What time did you get up today?" And I said 2 p.m. And she was like, "Okay, that's your last day. You're going to do it. You're going to do something this summer. I don't care what it is." My mom was a clerk at the hospital, and she said, "Come down and volunteer down there." And I actually went and volunteered, and I was trained and oriented by a guy who was a registered nurse. And I was probably 14, 15 years old. I had no idea that a guy could be an RN. And I thought, well, this is kind of interesting. And then I saw what all he did in his close patient interactions, and saw how, you know, nurses jump in and take care of patients or in an emergency or crisis, and talk to families and have patients that they take care of for 8 and 12 hours. And that really appealed to me, instead of going to medical school, pre-med medical school, and then residency or internship at the time, which would be like 12 more years. Mm-hmm. I thought I could do this in a couple years. It looked more appealing. And then the more I volunteered, the more I saw what nurses did in the emergency room, intensive care, recovery room, on the floors, and I really liked it. I thought, I think I'm going to go do this.
So when did you start? You started early, didn't you?
Mm-hmm. I started volunteering in '73. That's 19, not 18. And that was supposed to be funny, Bonita. Okay. Anyway.
For a moment I was thinking you were talking about your age at the time.
No, don't
I know
try
you just
to.
had your big birthday.
I did. I just turned 60, so that's okay. I'll try some better
you can
lines.
cue me in.
Yeah, right.
I didn't think the comedy would start this.
Oh, it will. So anyway, I played for worse crowds, so but that's all right. No, but I started in '73, and then I was as a volunteer, and I was hired as what was called a ward clerk in '75, and then I wanted to go to LPN school, licensed practical nurse. There's a little hospital in Covington by the river called Booth Hospital, and I applied to go there, and I went there, graduated in '77, and for 1 year, my tuition and books, everything was $425. And I was from a large family. I was one of 7 children, and my parents said, "We will pay half of it for you." And I said, "Okay." And so I worked every Friday and Saturday night, and went to school Monday through Friday, and got that. Got my LPN, started working in the ER in 1977 for Mercy Hospital in Cincinnati, and then stayed PRN here at St. Elizabeth. But PRN just like on call and stuff.
Did you want to do the ER? Is that something you wanted to do, or were you assigned?
That's a good question.
How does that work?
It really appealed to me. When I first went to the emergency department, I had been in other areas of the hospital. When I went to the emergency department, I felt like I was home. I just felt comfortable with seeing patients from all walks of life, you know, a homeless person, a CEO, everything in between, patients who are drunk, patients who are having a heart attack, somebody in an auto accident, and kind of all the above. I liked all of that. And I think it's a little bit of, I'm an easily bored person. Mm-hmm. And not to make fun of ADHD, but I think there's a little bit of that in a lot of ER people. And I'm very, you know, cognizant of that is a true diagnosis, but I think people kind of like that sort of putting out fires type work instead of having...
You're suited for that.
I squirrel, you think? Oh, there's a shiny thing. Okay. No, but I am. And I have energy. I have the enthusiasm. I don't want to just like, you know, kind of like a mundane kind of thing and stuff. Although I do know when to turn it on and off, you know, like where you're running around taking care of patients, but then there's other times where it's like, we can't save this person, so we're going to make sure they have a peaceful and dignified death, and so we're going to be here with them, and we're going to take it down a notch, and and this is the last thing we can do for that person. So it's kind
Well,
of,
as high energy as you are, your bedside manner is calming.
yes, well, thank you. I appreciate that. Have I taken care of you?
No, but I've seen you in action, and
Well,
of course on the TV show.
yeah. Well, and that is really a compliment to me, because if somebody says to me, "Oh, you made me feel so much better," or "I was really afraid, and I'm glad you walked in," or something like that, I like that. I mean, it's little things like that. I had a couple weeks ago, I had 2 young nurses who came to me and they said, "We're trying to get an IV in this lady and we can't." And one nurse had tried twice and the other nurse had tried once. And they said, "Could you come in?" And I said, "Yeah, because I'm usually pretty good at IVs." And I walked in the room, and this patient who was a little bit older, she said, "Oh, thank God somebody's going to start my IV and they have gray hair." And I thought that was the best compliment. But these 2 new nurses thought that was mean that she said that. And I'm like, no, that's a compliment. I thought it was great. And thankfully I got the IV in and everything. But I knew what she meant. Like, it's somebody who has some tenure and some experience and stuff. And so I thought that was
That
really
can be traumatizing.
Oh,
Just getting the
yes.
IV. My husband had surgery recently on his
Really?
shoulder.
really.
And he said the most traumatizing, painful part was because they couldn't get the IV in.
What?
To bring another person and another person. And it hurt so bad.
Well, tell Gene to
He-
call me.
He keeps
Okay?
talking about that part of it.
It's awful, because if you're not hitting the vein, you're probably hitting muscle or possibly bone, and there's a technique to it. There really is.
Yeah, some
Yep.
people can just go right in there.
You have my number. Give me my number.
I remember
Yeah,
that.
right. That'll go over really good when he goes in and says, "Yeah, I want Terry
I want
Foster."
Terry.
They'll be like, "Yeah, no, you're out, pal." That's good.
Was that more unusual at the time to be a male nurse?
Yes, very much
With a
so.
few men in your
Yes.
class?
As a matter of fact, I was a little embarrassed as to who I told that I was going to go to nursing school. I told a couple people that I was going to x-ray school because I thought that was a little more acceptable. And back then, probably 1% of nurses were men. And now it's about 11 to 15%, depending on what statistic you look at. And, I have not had any judgmental things happen to me because of that. But I know, like, people think, "Oh, isn't that a woman's job or whatever?" Well, I mean, when you're taking care of trauma or orthopedic trauma or surgery or some of the things we see, there's nothing glamorous or feminine about that. But I have to say, I cannot remember a patient who ever did not want me because I was a guy. I can't remember any patient who said, I want a female nurse. And there have been times where maybe if I answered a call light and there would be a little old lady sometimes, and they'd say, will you call the nurse, I need the bedpan. And I'd be like, "Well, I'm a nurse, do you want me to put it on?"
Maybe they think you're the doctor.
Well, and I got that a lot, but I said I can also get a female nurse for you. And once or twice they would say, "Oh, that would be great." And it's like, yeah, because I'm not here to convert your thinking. You're sick and you need the bedpan. We'll talk later, But
They may just be embarrassed.
Exactly, and I respect that, and I'm not going to say, "Oh no, you've got me," because that's an infringement on their rights, and especially today, being very aware of different cultures that I take care of now, that could be an offensive thing for a guy to take care of a female. So I'm very cognizant of that. I never want somebody to feel uncomfortable about that at all.
So what about your comedy?
Yeah.
Were you doing that in your teens too?
No, I was almost voted the quietest person in my graduating high school class. And I'm serious. Isn't that interesting?
It is, but on the other hand, many dancers, like myself,
Mhm.
and actors and singers, even many are shy people,
Yes.
quiet people, but
Yes.
their profession gives them the chance
Yes.
to come out creatively, but otherwise, no.
Yes.
Not always.
You're absolutely right. And I remember after I got out of high school, I wasn't as comfortable with my peers, I guess would be the best way to say that, in high school. And I felt a lot more comfortable when I got out and started working and I found my niche. And I don't remember saying to myself, I think I'm going to be funny. But I remember that, funny stories I really enjoyed. And when I worked at the hospital, a lot of the storytelling I thought were very learned experiences where they would tell about a patient or something happened, whether it was funny or a shocking thing. And I remember thinking, I don't know if I would have thought of that, or that's something I'll think about next time. And then through the years, when I would be teaching classes, if you have to teach things like advanced cardiac life support, arterial blood gas interpretation, identifying shock, those can be boring,
Dry.
technical. Yeah, you want to lecture on that right now? I'm sure
Only if there's a good story with it.
Well, and I when I would teach that stuff, I'd say like, now I'll never forget this time, and I always try to integrate a funny story in there that people would remember. And more, I would tell more funny stories. And oh, by the way, there's a little technical part to this here. But then now the main topics that I do are about humor in medicine, surviving the profession, thriving, things like that, unusual cases, that kind of stuff. I can still talk on like shock and critical care drugs and trauma, but if I'm asked to go someplace to lecture, it's usually the humor and how can I maintain my sanity? How can I cope? How is this going to get me through? Because I've been doing this 40 years. It is so stressful in healthcare. Healthcare workers, especially nurses, are so stressed. And it's not any one factor. It's a lot of things. There's usually staffing issues. Every patient is so sick. Every patient is not just sick, but they have social problems. Their heat's been turned off. They can't afford their medication. They know their family doesn't want them. They're a drop-off. There's all these issues of coming back, and there's chemical dependency and all that kind of stuff to where it's really difficult. It really is. And you need an outlet, to sort of maintain your sanity. And I think it prevents burnout and helps people to say, hey, you know what, I can do this again. Mm-hmm. Somebody else helped me find the humor in this, I can get through it.
One of my bosses at Arthur Murray's when I started had been a nurse in the ER, a nurse anesthetist.
Yes.
And she said, if you don't start seeing the humor in the things that you're seeing every day, you'll go crazy.
Yes.
Of course, she had lots of stories too.
Yes,
but
yes.
She said you have to develop that sort of
absolutely
ability to deal with that and see some humor, or you have to leave.
Yeah, you do. And if you don't have the humor, you're going to burn out quicker. We have people that burn out or sometimes turn to drugs or alcohol or anger issues or things like that. So you have to have the humor. So that's a good way to cope, and that's how to get through it. But also, you can never get used to heartache and tragedy. And actually, like the worst thing of an ER nurse is to have a child come in that dies. And obviously that's just for the nurse, not to mention the parents and the family. And it's very bothersome. And I can remember almost every child that I've ever had in the ER. This story, this scenario, I can remember one in 87. I can tell you the day it was in December, the father, I can just remember all of that. And I always say the day it doesn't bother you is the day you need to leave, But still, I had a patient a few weeks ago that came in and cardiac arrest and died, and we worked on him, and I dreamed about him all night long, just about working on him and stuff. Didn't know the person at all until obviously after, and I the next day I kind of felt like, I'm kind of glad that still bothers me, I mean, it really did.
You still have your heart.
Yes, exactly. And he was younger than me, and just all those things you look at, and I just but I'm just glad it bothered me. It didn't make it easier, but I thought, yeah, because I've been doing this a long time. Anytime you get used to that is when you need to find something different, for sure. So.
Are you dealing with a lot of addiction now?
Yes.
In the ER?
Yes.
Overdoses
You mean
and-
personal or what? Okay, this is
We'll
on
discuss
camera.
that.
I'm addicted to Diet Coke. They said Trump drinks a lot of.
I got over that one.
Did you?
It took me a long time.
I might have to call you. But no,
I finally quit.
Did you? Well, I'm gonna have to taper off. The opioid epidemic is terrible. It encompasses every part of healthcare. Either from the fact that we have patients who come in who overdose. We actually don't see as many patients coming in who have overdosed because their families treat them with Narcan, or the police officers or the life squads, and they refuse to come in and stuff. And so we don't see as many in the ER as what we used to, but we still do see those. But it is really a street problem now because they're quickly revived there. But it impacts how you get a prescription filled.
Yes, it does.
It impacts how I do it. Impacts how we write them, how you get a second prescription if possible. It impacts multiple levels of healthcare for who can be seen, who can't, what's covered, and it's just a major problem. And there's not a lot of resources for people. We're trying to build resources for it, but especially if you don't have insurance, sometimes even if you do, your resources for that are very limited, and it is such a highly addictive drug. I've obviously never tried it, but I've had patients who have said, I tried it one time.
That's what I hear.
And that's very
Sometimes
scary.
the one time
Yes.
kills them.
Yeah, exactly. And I've had patients say when they got high the first time, that each time after that they try to capture the original high, if that
It
makes
takes
sense.
more, yeah.
Yes, and it takes more and more. We even sometimes, if a person overdoses on heroin, some of their friends want to know where they got that heroin because that was so good that it killed that person, and they want to get that. Now, how sick is that?
I've heard doctors talk about that.
It's
That's
sick.
how far it
Yes,
changes the
yes, exactly.
and it stays. I read too that it stays in the brain
It
for
changes
30 years.
and can change the metabolic and physiologic structures and processes in your brain, and just to where that's what they're consumed with is just getting high again. And as you know, you see on the news where people like, they don't care if their kids are in the car, potentially
No,
killed or anything.
happens
The
all the
drug
time.
is more important than anything else. It's frightening. It really is.
Another thing I wanted you to maybe talk about a little bit is head injury. And I just watched one of your ER shows
Okay. All right.
where the guy was hit on the head. And this is the one where you were talking to the fellow that you thought it was his
Oh
friend.
yes, yeah.
And of course,
yeah.
he had never met him before.
Yeah, but he didn't say that.
He
Let's
didn't say
clarify.
that.
Yes.
He really just kind of went along with the story.
Yes.
So people will have to watch the show. But I'm still surprised how many people aren't aware of the risk of head injury and will let someone lie down and go to bed that's fallen, an older person that's fallen,
Right.
and they don't realize
That they
the
need.
swelling of the brain that you can lose that person.
Yes.
It's still not
Yes.
that well
Yes.
known.
And we tell people, like, if somebody's been hit in the head, if anybody's ever knocked out or loss of consciousness, they have to go to the ER. You have to get a CAT scan. End of story. If they're knocked out, that's non-negotiable. And they also need to have a neurologic evaluation by the doctor and the nurse while they're in the ER, the vitals, the pupils, how they're walking, talking, all that kind of stuff. And caregivers know somebody better than anybody else. I just met the patient, but if the patient's wife is there, I say to her, what do you think? And they're like, something's wrong with him. I'm like, okay, we'll go with that because I don't really know for sure. So once that stuff's ruled out, we tell them they can, if you're with them, somebody needs to stay with them, but they can go to sleep, but you have to wake them up every couple of hours. Make sure they wake up okay. It's going to be a long night. Bring them back if they can't walk, talk, if they're vomiting, if they're having difficulty speaking, anything like that. But sometimes people just think, oh, I'm okay, like Natasha Richardson, Liam Nielsen's wife. There was a story about her. I think she was hit in the back of the head with a ski lift as she was getting off
There was
of it.
something in the skiing
Yeah.
accident.
And
she didn't want to go.
Right. She refused to and went back to her hotel room and went to sleep and was found. She was unconscious, but still had a heartbeat and respirations. I think they flew her to New York, and then she was brain dead. And that, of course, this is my source is the National Enquirer for that, so, reputable medical source there. But it was very sad. I mean, here's a beautiful, cognizant person who really, if she probably would have been evaluated, that's usually, it's called an epidural clot, and they can go to the operating room, have that removed, and people do really well after that surgery usually. But the problem is how quickly you identify it and get it treated.
And the window, is it a 4-hour window? Is that
it-
true, or
it
is that
depends.
really not that?
It really depends. It could be 4 hours. It could be a very short period of time. It could actually be like with what they call subdural hematoma. Sometimes those aren't discovered till later on. Like they'll say, well, I think grandma's got Alzheimer's. And you say, well, really? And they go, yeah, just in the past week she's been real confused and disoriented. Well, that's not how Alzheimer's presents. It's a very gradual onset, as you know. So it's like, has she had a CAT scan? Did she fall and hit her head? Because elderly people and alcoholics are very, prone to head injuries because they kind of fall a lot, and people think, well, they're acting different because they're old or because they've been drinking, and don't realize there's a lot more going on with that. So, yeah, it's just kind of like Dr. Oz instead of Terry Foster. Because we ain't going with Dr. Oz. Jeez, sorry.
We're not going to talk about that show. Well, let's talk about the Untold Stories a little bit.
Sure.
How did that first start?
Actually, a person called me at work and left a message and said, I would like to, I'm going to answer the phone, and she said, I'm from Untold Stories at ER. I had never heard of that before. And
How new was the show?
brand new.
Okay.
It was going to be the first season they were still filming. And
Had they heard of you, or they were calling hospitals and asking?
They heard of me. I was going to answer, but you interrupted. So
I'm trying to keep up with you.
you want to turn it off now? Get out. No,
Get out while the getting's good.
Yeah, that's right. No, I do a class on bizarre and spectacular cases, and I do them in other areas of the country. And I was doing that lecture in Seattle, and this producer was surfing the net for like those key words, and it came up, and she said, I'm doing this show. We might like to have you on the show. Could I come and hear you do the lecture? And I thought it was my neighbor playing a joke on me.
Funny.
Because she was like, I said, well, yeah, okay, Miss Producer, let me give you a call back. What's your number? And she goes, can you just talk now? And I go, no, Miss Producer. I'm like, give me your number. I'll call you back. So she gives me this number, and I said, I'll call you back. So I hung up, and I thought, I'm not calling this number from here because it's going to be a phone sex number, and it's coming from my office that I'm calling. So I waited till I got home, and I called, and they said, the Learning Channel, and then this entertainment thing, and then I got connected to her, and I said, I'm really sorry. I said, I thought this was a joke. And she said, really? I said, yeah, I thought you were one of my friends playing a joke on me. And she goes, what kind of friends do you have? And I go, well, it's more, what kind of friend have I been? Okay, because I've done a lot of practical jokes, so I'm on high alert, okay? And so she and another producer came to hear me do this talk. And they were like maybe late 20s, very beautiful girls, and in the production, they were production assistants. And after the talk, they said, oh, you did really good. We love to talk, but we can't use you. And I was like, okay, you all flew here to hear me, And they said, I said, why can't you use me? And they said, well, we only use doctors. And I said, well, it says RN after my name. I've never said I was a doctor. And I said, why do you only use doctors? And they have a background in media and entertainment and film. And they said, well, doctors know more about what all's going on, and they tell the nurses what to do. And I said, I'm going to have a stroke here. I go, can I just tell you
Is that
this?
a learning experience?
Yeah.
Now?
I said, this is what I do. And so we actually they had a little bar there at the hotel. We went in there, and I said, this is what I do. And really, in a very nice way, they were schooled. They had no idea that nurses did that. And I love my doctors. I mean, we work very well together, but we do stuff for them, they do stuff for us. But it's not like I would say to a doctor, would you want me to put an IV in? It was like I would have that in probably before he or she got in the room. So when I went to go, we Skyped for the script, but when I went to go film it, a lot of the scenes are filmed out of sequence from when you see them, which I didn't realize that. So they were actually filming the closing scene first. And that involved the doctor getting a wheelchair and going in the room and getting the patient dressed and putting her in a wheelchair and wheeling her out to her car, the doctor. And of course I said, oh, hell no. Okay. I'm like, I'm sorry.
I would think most of us would know that doesn't happen.
Exactly. And interestingly, the show wants to make it very accurate. So they were like, a doctor wouldn't do that. I said, no. Plus, in a nice way.
Surprising they would even think that.
Exactly. And I don't want my doctor wheeling a patient out to the car. If that's the emergency room doctor, I want him in the ER. So they've changed some of those things around and stuff. And there was like, I don't know, there was kind of a line where when I came in the room, the doctor said, Terry, start 2 IVs and put him on oxygen. And I said, you guys, I would have had that done, you know, and not that I feel very comfortable in my job and stuff like that, but I just felt like as a representative for the profession, I needed to
let's
say,
tell the truth here.
Yeah, exactly. And they've been very good about that. They've been like, okay, we want it accurate that way. What would you say, or what would you do, or something like that? And I said that's, and I appreciate that. And so obviously the first one was a learning experience, and then for each one, I really have a lot of control's the word, but a lot of input into how that's done. And of course, there's sometimes they want you to amp it up. I mean, it is an entertainment kind of thing. In one scene, a maintenance man fainted, and I went over to help him, and they're like, you know, you need to call for help and get the crash cart and call for the doctor. And I'm like, he fainted, like, and they go, but you need help. And I'm like, if a person fainted in the ER and I yelled for all that, I mean, my coworkers were like, what do you want, jackass? What are you doing?
Are you incompetent?
Yeah, right, you fainted, get over it. I'm working on a heart attack in here. And so, anyway, so there's a few times where they'll say, well, you know, we're going to add this for dramatic effects. So I get that. And it's nothing that's like, you know, like I'm uncomfortable with or anything like that. It's an entertainment show. I have very interesting emails about that show, though, where people watch it, and I've had people correct me on maybe if they thought I contaminated a sterile field, or I shouldn't have.
Oh, I'm sure.
Recapped it.
You should have done this, and you should have done that.
And I'm like, you do know this is a reenactment TV show, don't you?
It's not the actual.
It's not real time. I did have one really sweet lady who called me, and in one episode she really liked the physician, and she wanted to come. You know, you can Google me, and she found out where I worked, and she wanted to come here to see that doctor. And she said, you know, that black doctor. And I actually knew who she meant. And I said, ma'am, he's an actor. And she said, oh no, he's a really good doctor, and I really like him, and I want to come see him there, and I'm going to come up, I'm going to make arrangements. I just can't find his phone number and stuff. And I'm like, he's an actor. That's filmed in Canada. He's not a doctor. And I wanted to say, I even had to help him pronounce some of the medical terms, which is fine, but he's not a doctor. She was convinced that he was a really good doctor, and she wanted to come see him.
Well, people believe that.
Yes.
On TV shows,
Yes.
that the character is, that person is that character.
Yes. And there's several episodes they have on YouTube. It's on Netflix and stuff too, but especially on YouTube. And sometimes I'll get on there and I'll read the comments. And some of them say, you know, he's such a nice nurse. I hope he takes care of me if I'm ever sick. And then others have said, like, he seems very judgmental and doesn't seem very nice to people. And I hope he doesn't take care of me. And you know, and he should have never said that or laughed about that. And I want to get on there and stuff and say, you know, you guys, this isn't.
Take it easy.
I know, truly. But it's like if I put one comment, then 50 more will follow and stuff. But it's interesting to me what people's perceptions of that are. You know, like how they're taking that what you are saying. And I tell people a lot, like in our profession, people remember what you say to them or what goes on for years. I've had
But you would never remember.
No. And I've had patients say, like, oh, I was here one time and I was in room 232 and the doctor, Rangi, he came in and they did this, and then the other nurse came in and she did this and that. I'm like, when was that? I don't see that on your chart. They go, it's 1971. It should be on there. And I'm like, oh But that's how you do remember things like that, especially if it's, you know, kind of a urgent or a desperate event in your life. You remember that stuff, and you know, sometimes a real caring thing people can remember for a long time, but also kind of a flipping remark people remember for a long time.
Or what they took as.
Yes.
Or you're not maybe
Exactly.
looking at them or
Right.
something.
Right. I got reported one time, I probably shouldn't say this on tape, but I am. We had a patient who came in who died, and we worked on him, and we were getting the paperwork together, and another nurse and I said, what else do we need to do? And she said, oh, she goes, let's go in and get his valuables. And I said, okay, because we lock up their valuables in an envelope. Well, a patient heard us say that.
Oh my. They
And
thought you were.
Yes,
You were
and
going
so
to
she
take them.
sent her son out to the lobby to get a guard, and she had the guard come back, and he comes back, and they're like, that's them, they're the ones. We're like, what? You're taking valuables from the dead man, and it was like, yeah, we are, but like it's legit. Like, but she thought we were like rolling a dead guy here, because she heard us say, oh, let's go get his valuables, and she knew somebody had died there. And that's what we did, was Michelle and I, we got him and put it in an envelope and sealed it up. And we had to call security to get it. And we had called him. So he was there for 2 calls not knowing it was both things. So people interpret stuff completely different. But, you know, if you're in the ER, there's a good chance you're in pain, you're worried, you're sick, you're stressed. And obviously what you take in and what you receive and things like that can be very skewed and stuff.
Oh,
So
yeah.
I
I'll
don't
have to
judge
tell
people.
you the story. My sister's a nurse.
Oh, really?
And she used to go to the
No, you're
houses.
telling me a story. Is this about me or about you?
This is about my sister, but it's just
Okay.
you'll appreciate it.
That's good.
She would
I'm
go
gonna
to the
take a
homes
drink.
and do medication and
Yeah.
medicine. And she had this one man she always took care of. And he would just beg her to rub WD-40 on his knee.
WD-40?
Yeah. You know, oh well.
What-
And she would say, no, I can't do that. And he just begged her all the time. So one day she rubbed his knee with Jergens lotion. And she said, yes, I'll rub your knee with WD-40.
Oh.
And he was so happy. Oh, that's so nice, Tracy. My knee doesn't hurt. He was so happy. So he thought he was always getting this. So another nurse went to take care of her patient one day. Oh, please rub my knees with WD-40 like Tracy does.
Oh my gosh.
She got called up by her boss. She said, I just put hand lotion on his knee and it made him happy that it was WD, but it wasn't. Well, you can't do that.
Oh,
You
you're
can't say
kidding.
that. And she got in all kinds of trouble.
Oh.
But he was happy.
Yes, exactly.
He thought that's what it was. It was just soothing to him, and she
Mhm.
rubbed it on, so she went along with it. But
I know of a nurse, this happened years ago. Little old lady was in intensive care, and she had all these tubes and wires and everything. And the nurse said, "What can I do for you today? What do you want?" And she said, "I want to get up in the chair, and I just wish I had some makeup on and somebody fixed my hair." And she said, "By God, we're going to do it." And she's a true patient. Yeah.
Like some kind of, beauty parlor or something. And she fixed her hair and rolled it and put all this makeup on it and got some kind of special, like a bed jacket or anything. And she looked like $1 million and just felt so good. And her family came in and they just were so impressed at how good she felt. And a head nurse or somebody came in and said, "Did you get her readings, like on the machines, like the Swan readings? Did you get this? Did you get her lab work?" And she was like, "No, I did what she wanted. Like, this was the best thing in the world." And she got severely reprimanded for that. And I mean, if a patient's in a chair and she's letting you fix her hair and put makeup on,
she's doing okay.
Yeah, exactly. You don't have to check all
That
these
does so much
readings.
for people.
Exactly.
To have their hair done or their nails done.
And there are many times you sort of have to, if I've said to a patient, "What do you need?" We're saying what all we need. We need to do an x-ray, we need to do lab work, we need to do this, we need to do that. What do you need? What can I do to make you better? Or how can I help you out? And I've had family members in the hospital when people ask us that. To me, it's like, thanks for asking, because this is what I want here. These 1 or 2 things. And I think it gives you
a great perspective. But this nurse, that probably happened 40 years ago, and she's told that story many times. And she said, you know, I think she ended up getting terminated because
Wow.
she wouldn't, you know, concede that that was poor judgment, and that's what they wanted her to do. She was like, no, I would do the same thing again tomorrow. That's what that little lady wanted, you know. And probably the little lady, you know, died of, I don't know, whenever later, a few years later or whatever, but I'm sure that was the day that made her feel better than anything else.
Mhm.
So I like that. I like those kind of stories.
Yeah.